Our ethical dilemma presentation is titled Locked Up, Not Locked Out, and discusses the question, should prisoners receive expensive experimental treatment? The topic of prisoners receiving expensive or experimental medical treatment poses an ethical dilemma because of the two conflicting ethical principles of justice and utilitarianism. On one hand, everyone, including prisoners, should be treated equally and should have access to non-discriminatory healthcare services. On the other hand, action should benefit society by maximizing the overall well-being of the community as a whole to the best of their ability. This topic matters because it examines issues regarding human rights, legal obligations in healthcare, and themes of social justice or equality. If every individual, regardless of their legal status, has a fundamental right to receive adequate healthcare, then it's important to discuss if these same rights apply to prisoners. There's also the consideration of economic costs, resource allocation, moral obligations of society, and social challenges that this topic encounters. Some medical treatment are expensive and limited, so it's important to decide who should have access to them first. Moreover, the issue holds implications for the future of prisoners' physical and mental well-being. These decisions not only affect current prisoners, but also imply society's stance on the limits of human rights, equality, and utilitarianism. Therefore, it's important to discuss if prisoners should have full access to healthcare, as it includes vital aspects of justice, human rights, public health, economic obligations, and societal values.
Prior to the 1970s, being sentenced to prison meant one's health was considered at risk. It also meant that the average time a physician spent with each patient was approximately 1 minute. Basic medical care was considered inconsistent and not equally available, and healthcare treatments and procedures were performed by people with little to no medical training. This resulted in second-class care. A U.S. Supreme Court decision in 1972 found that in Alabama's prisons, there were prisoners without any formal medical training that were performing procedures such as extracting teeth, dispensing drugs, operating X-ray equipment, and minor surgery. Additionally, medical treatments were withdrawn and used as a punishment to discipline prisoners. Once the federal courts intervened, rights to basic care was established. Standards were implemented and medical staffing increased as well. From 1970 to 1997, the number of individuals entering the prison system grew by 5 times. At the same time, the prices of healthcare services in America soared as well. Henriksen describes that out of the 40 states that were surveyed, representing more than 1.2 million inmates, the total per inmate cost averaged about $31,286. With an approximate amount of 1.2 million incarcerated individuals, we wanted to focus on one financial impact on the healthcare system, the economic costs of healthcare services in prison. The increasing demand for routine medical care and extensive treatments imposes a significant financial burden on the healthcare system due to the increased staffing, medications, and equipment that are required in prisons. The number of prisoners in a prison directly impacts healthcare costs. Larger prison populations requires more resources to provide healthcare services. In the United States and many European countries, taxpayer funds are used to cover the costs of prisoner healthcare. These funds are typically allocated through government budgets to provide healthcare services to these incarcerated individuals.
The Eighth Amendment of the United States Constitution states cruel and unusual punishment cannot be inflicted on incarcerated individuals. This relates to the topic because denying prisoners access to necessary medical care can result in severe harm, which can be considered cruel punishment. This amendment directly relates to the topic of prisoner health care as it establishes a constitutional duty to provide adequate medical care to prisoners and serves as a safeguard against cruel punishment. Although there may be debate among whether access to expensive medical treatments can be seen as a punishment.
Two arguable sides to the dilemma on prisoner health care. Side 1 to the dilemma is prisoners should have the right to receive expensive experimental treatments. This can help reduce prejudice, improve health equity, and lead to an increase in medical research. Side 2 of the dilemma states that prisoners should not have the right to receive expensive experimental treatments. This can help tackle the issues of increasing healthcare costs in the U.S., as well as allocating resources enough to be able to provide healthcare for the entire prison population, which is quickly growing.
Side 1 states that prisoners should have the right to receive both basic medical care and expensive experimental treatments. According to the equivalence of care principle, prisoners must have the benefit of care equivalent to that dispensed to the general public. This concept emphasizes that people should receive healthcare that is equal in the terms of both clinical effectiveness and outcomes, regardless of factors like their legal status. Additionally, Nuevo notes that physicians have a duty to provide prisoners with protection of their physical and mental health and treatment of disease of the same quality as those who are not detained. Ensuring that prisoners' access to adequate health care is not only a legal obligation, but also a matter of fundamental human rights. Along with the 8th Amendment of the U.S. Constitution, there are legal implications and a constitutional mandate regarding prisoners' rights to receive health care. In some cases, experimental or expensive treatments may be medically necessary when conventional therapies have been proven ineffective. This is especially important if the outcome significantly impacts a prisoner's health and quality of life. It reflects societal values because the way that society treats its incarcerated individuals is a reflection of our priorities and stances on equality. We should advocate for the right for all people to have access to medical treatment without discrimination, especially in populations where mental illness, substance use disorders, and communicable diseases are very prevalent. Magloire states that prisoners are less likely to have a primary care provider prior to incarceration and are disproportionately affected by the social determinants of health. This means that most prisoners already do not have a chance to access health care. Instead of supporting the cycle of discrimination, prisons can serve as a place for people to establish connections with community support and healthcare facilities that will promote their health above all. Whether they're incarcerated or not, our society should increase access to medical treatment for low and middle income communities. Prisons can serve as a starting point where these populations are diagnosed and treated, thus decreasing the burden of diseases and improving health equity. The ethical principle that most supports our side of the argument is justice, because all individuals, including prisoners, should have an equal access to healthcare services. If everyone should be treated equally and fair, access to healthcare should also be non-judgmental. Denying access to healthcare solely on their status as prisoners would be seen as unjust and discriminatory. By eliminating prisoners' access to expensive experimental treatments, one would be denying their right to all treatment options based on their status as prisoners. This contradicts the ethical principle of justice, as all people should have equal rights to choose whether or not they want to receive expensive and experimental medical care or not. In alignment with the ethical principle of justice, the option to receive treatment should at least be available. This topic is important to me because healthcare can be seen as a right for all individuals. I believe that access to healthcare should be non-discriminatory and available no matter what your race, gender, religion, and incarcerated status is. Also, denying prisoners of medical care can lead to an impact on public health, such as disease transmission, and alleviate not only physical but mental suffering. This can lead to improved quality of life and a better system of rehabilitation or reintegration into society.
Prisoners should receive expensive and experimental treatments because prisoners develop or already have illnesses that need to be treated constantly. Ray Wright mentions that COVID-19, for example, has an impact on prisoners' health care because it reduced access, which affected the health of prisoners by exacerbating existing conditions, new conditions being undiagnosed, and mental health needs increasing. That leads us to the next point, that prisoners' health have gotten worse even if they had the health conditions or not, and health care did not even try to better their health. And then also, experimental treatments can offer an opportunity for scientific and medical research, potentially benefiting society as a whole.
The provision that most closely aligns with our side of the ethical dilemma is provision
The solutions that we have for prisoners to receive both the most basic medical care and expensive experimental treatments is by cost-effective solutions or any financial cost that can be left over that could be put towards any treatments that prisoners might need for their health. One cost-effective way to achieve these goals is seen in the expansion of ACA and technological advancements. The next solution that we have for the future is the use of telemedicine and ACA/Medicaid expansion. Telemedicine can provide treatments in correctional facilities while reducing the cost of inpatient stays and decreasing spending on transportation and security. According to Pew Charitable Trust, significant correctional cost savings were seen in Ohio and Alaska due to the expansion of the Affordable Care Act. Medicaid expansion can also achieve millions of dollars in savings because most correction hospitalizations already qualify for coverage. Overall, prisoners should have access to medical care and should really receive giving expensive treatments due to the fact that basic medical care will not do justice compared to the expensive care that everyone else is getting. It can still treat conditions, but not as best as the rest.
Prisoners should have the right to only basic medical care rather than expensive experimental treatments. According to the utilitarianism ethical principle, we believe that on a community scale, basic medical care for prisoners would be more beneficial due to costs and expenses. Utilitarianism requires careful consideration of resource allocation. It suggests that resources should be distributed in a way that maximizes overall utility. In the context of prisoner healthcare, this means that resources should be allocated to treatments that provide the greatest benefit for most individuals. Henriksen explains how in 8 states, a portion of the cost for inmate hospital care is funded outside the corrections department and how more than 1 in 100 adults are in prison or jail nationwide. This trend has come at great cost to taxpayers. State corrections spending has nearly quadrupled over the past 2 decades. Pew Charitable Trust also states that the average age of those behind bars is rising, and that the health needs of these individuals, like older people outside of prison, are more extensive than those of younger cohorts, including more hospitalizations. Complex, expensive treatments often result in multiple sessions or routine follow-ups. Nevu describes that complex treatments cannot usually be continued after detention, or they may be interrupted on transfer from one prison to another prison. This can result in higher costs and ineffective plans to treat prisoners. If an expensive treatment cannot be continued at a different prison facility, that treatment will technically have gone to waste. From an economic perspective, certain medical treatments that are complex cannot be easily adaptable in the correctional setting. It is important to keep standards of basic care. However, complex, expensive treatments can interfere with this as a result of the reality of their environment. I am arguing this side because I believe prison healthcare is an interesting and complex issue that tackles issues with our healthcare costs in America. Limiting expensive experimental medical treatments for prisoners and focusing on only basic medical treatments is important because our focus, 1, is to reduce healthcare spending, and 2, is to maintain appropriate allocation of these United States healthcare resources.
Delivering adequate medical care to the more than 1 million adults in state prisons is a grand challenge for states, in part because of the high costs and complex logistics required to hospitalize people who are incarcerated. Pew Charitable Trust notes that most incarcerated individuals experience the effect of age sooner than people outside of prison because of such issues such as substance abuse disorder, often inadequate preventative and primary care before incarceration, and stress linked to isolation and the sometimes violent environment in prison. In the prison system, resources are limited, and it is essential and important to prioritize spending on basic health care for all inmates rather than using scarce resources on expensive experimental treatments. By providing basic medical care, it can help ensure the health and safety of the entire prison population rather than a select amount. Hospitalization expenses are already a significant portion of correctional healthcare spending and are likely to grow if prison trends continue. The average age of those behind bars is rising, and the health needs of these individuals, like older people outside of prison, are more extensive than those of younger cohorts, including more hospitalizations. Providing prisoners with basic medical care will not harm the individuals and will supply more resources for the entire population in comparison to only a few individuals receiving expensive medical care. Although expensive medical treatments will not be provided, necessary basic services to ensure prisoners' health will still be provided, which means the physician is meeting their ethical obligation to the patient. 7%, or 25.3 million Americans of all ages, did not have health insurance in the first 3 months of 2023, compared to 8%, or 26.4 million during the same period in 2022. Despite policy efforts to improve the affordability of coverage, many uninsured people cite the high cost of insurance as the main reason they lack coverage. In 2021, 64% of uninsured adults said that they were uninsured because of the cost of coverage was too high. Many people do not have access to coverage through a job, and some people, particularly poor adults in states that did not expand Medicaid, remain ineligible for financial assistance for coverage. Additionally, undocumented immigrants are ineligible for Medicaid or Marketplace coverage. The uninsured often face unaffordable medical bills when they do seek care. In 2021, uninsured non-elderly adults were over twice as likely as those with private coverages to have had problems paying medical bills in the past 12 months. These bills can quickly translate into medical debt, since most people who are uninsured have low or moderate incomes and have little, if any, savings. Since prisoners are incarcerated as a form of punishment, this limits the amount of autonomy they may have in daily life decisions and medical care. By providing them with expensive medical treatments, this may be looked at as allowing them with privileges that do not align with the purpose of being incarcerated, and that are unfair to law-abiding citizens who do not have the same options. There also may be concerns on the ethics of conducting experimental treatments on individuals who may not have the capacity to provide informed consent, or who may be persuaded into participating in research studies while in prison. I am arguing this side because of my stance on lowering healthcare spending in America and filling the gaps between the uninsured general population rather than the incarcerated individuals. I believe basic medical care is sufficient and can help ensure the health and safety of the entire prison population. Codes and duties. The specific provision of the professional code that applies to our side of the ethical dilemma is Provision 3B from the Healthcare Executive Code of Ethics. It states, provide healthcare services consistent with the available resources, and when there are limited resources, work to ensure the existence of a resource allocation process that considers ethical ramifications. Therefore, this provision can relate to the ethical dilemma because resource allocation in the prison healthcare system involves budgeting for medical staff, medications, medical equipment, mental health services, and other healthcare-related expenses. Prioritizing resources is essential as there are often limitations in terms of budget and personnel. Decisions must be made regarding which services and treatments take precedence. Prisons often operate with limited budgets, which is why it is important to limit expensive treatments if they are not essential.
The most important solutions for the future would be the use of telemedicine, use of generic drugs rather than brand name drugs, and negotiating healthcare providers to advocate lower costs for incarcerated individuals. Our side thinks that telemedicine is especially important as it would help reduce transportation costs, copay costs, and increase efficiency. By expediting the healthcare process for inmates, this can allow inmates to have access to the necessary medical care without long waiting times, which as a result can prevent the progression of major health issues and decrease the chances for more extensive, complex, and expensive medical treatments. In addition, overall healthcare expenditures can be reduced when healthcare providers and prison systems can prescribe and provide generic drugs instead of brand names. This can also help provide inmates with increased access to the essential medications that they may need, which has been proven to lead to better health outcomes in the long run as a form of preventative care. Negotiations are really effective as well. Examples of this include bulk medication purchasing, leveraging government contracts, and using long term contracts in the benefit for prisons.
In conclusion, prisoner healthcare can be considered an ethical dilemma for several reasons, primarily due to the tension between the rights and needs of incarcerated individuals and societal views on punishment and justice. If every individual, regardless of their legal status, has a fundamental right to receive adequate health care, then it is important to discuss if these same rights apply to prisoners. There is also the consideration of economic cost, resource allocation, moral obligations of society, and societal challenges that this topic encounters. Some medical treatments are expensive and therefore limited, so it is hard to decide who should have access to them first. For example, a prisoner is serving a long sentence for a non-violent crime and has a history of diabetes and hypertension. During his sentence, he develops kidney failure and severe neuropathy due to his diabetes. He urgently needs a kidney transplant. However, this procedure is expensive. Therefore, should this patient receive the kidney transplant? The ethical principles that may conflict in this ethical dilemma are justice and utilitarianism. Side 1 advocates for justice in this ethical dilemma due to its stance on fair distribution for all. This is why Side 1 justifies expensive medical treatments and equal access to healthcare services for incarcerated individuals. However, Side 2 believes that there is more benefit in satisfying the most amount of people, which is more effective on a community-wide scale. This will benefit society because it will reduce costs in prison systems and reduce taxes for law-abiding citizens.
In conclusion, Side 1 argues that prisoners should have the right to receive both basic medical care and expensive experimental treatments because access to health care is a fundamental human right. Upholding the principle of equivalence of care entails advocating for universal access to medical treatment free from discrimination, especially in communities with high rates of mental illnesses, substance use disorders, and communicable diseases. Additionally, one should recognize prisoners' constitutional right to medical treatment while considering the possible financial solutions that will enhance health equity and obtain these objectives. Side 2 argues that prisoners should receive basic medical care, excluding expensive medical treatments due to the increasing high costs in health care for incarcerated individuals. From an economic perspective, certain medical treatments that are complex cannot be easily adaptable in the correctional settings. It is important to keep standards of basic care. However, complex, expensive treatments can interfere with this as a result of the reality of their environment. This current healthcare system is already financially challenged, and expensive treatments for prisoners can furthermore increase the cost. To conclude, we believe that the most important solutions to reduce the cost of healthcare services in prison through legal changes. Other solutions can be the use of telemedicine, use of generic drugs, and negotiating with healthcare providers to advocate lower costs to make it more affordable for prisoners. Telemedicine can reduce copay and physician visits costs, and generic drugs can provide these same results while limiting the barrier of unreasonable prices in the prison system. Our group worked together by dividing up the different sections and doing individual research on specific topics. We all collaborated on a lot of questions and discussed each of our perspectives on them. We all communicated and asked questions and helped one another out.
Should prisoners have the same access to medical care as non-incarcerated individuals, or are there ethical or practical reasons to limit their access to certain treatments? Please reply on the discussion post below to answer this question.
And then these are our references, and thank you for listening to our presentation.